The Honourable Emily Saville says that COVID caused the heart problems.
The risk of having pericarditis or myocarditis was significantly higher in people with COVID-19 than people without.
I would like to correct the Honourable Emily Saville. Nobody is saying that anymore. That's what they were saying 2 years ago, and you're very welcome to email me a report saying anything. They've got very quiet on that. They said COVID was causing heart problems.
Where people were doing the best that they could with the information they had before them at the time.
Well, their best was bad. Cameron Murphy says,
well, it's much more than a bad flu. It's something that threatened the nation.
Okay, the average life expectancy in Australia of somebody who died of COVID was higher than the average life expectancy in general. Okay, that's a fact. Nobody can deny it. So that's how serious your pandemic is. Okay, the average life expectancy is about 86, and the average COVID death is about 87. Dr. Conn said that she thought it was terrifying when the data came out of Italy.
We saw the data, we saw the science, we spoke to our colleagues working in other countries to hear about what was happening with this terrible, very infectious disease.
I thought that when the data came out of Italy in March 2020, it was a huge relief. We weren't dealing with the Antonine Plague, we weren't dealing with the Spanish flu, we were dealing with a flu. And every winter, all around the world, people who are in their mid-80s with chronic health conditions die of the flu.
And I was working as a GP at that time, and I also did shifts in emergency departments. My partner was working as an enrolled nurse on the medical ward that became the COVID ward at our local base hospital. And we sat down together and had a conversation about the fact that we might die from our work. We sat down together and we held hands and we said, we don't have children. We're going to keep working. Like we were willing to put ourselves on the front line to continue. We had friends and colleagues. I had a colleague who was pregnant who decided not to work, and I respect her decision. We decided to work because we thought we could die, and it was a service we were willing to give to our community. And we waited with absolute bated breath for a vaccine to be developed. And when the news came that there was finally a vaccine, I cried tears of joy.
Well, welcome to today's talk, Friday the 25th of November. Now, for the first time in the United States, we've got data that says there's been more COVID deaths in people that are vaccinated versus people that are unvaccinated.
You mentioned Dr. Fauci, and I want to go a little bit deeper. He talked about it being conceivable that we'll have a vaccine by the end of this year or just slightly into 2021. This has not been your position in past interviews. Knowing that the answer could be a lot, what does he know that the rest of us don't?
You know, I don't know, Brian, and I will tell you that Dr. Fauci is one of the most respected public health experts in the world. And so people pay attention to him. But I have no idea how somebody is proposing a shortening of the length of time it's going to take to test this, whatever new vaccine there is out there, for both effectiveness and safety. You know, in 1976, President Gerald Ford was the first to get his injection of swine flu vaccine to prevent and control the swine flu at that time. But it turned out that that vaccine, a couple of years later, was shown to have very serious neurological complications. This is just a process we cannot rush and still feel like we're being safe. We already have a big anti-vax movement in the country in terms of measles and other vaccines, Brian. So if we have something happen, a mishap with a new vaccine, even if it's 6 months, a year later, that will be devastating for our attempts to get the world vaccinated to prevent the coronavirus. It's a very tricky situation, and I have no idea why Dr. Fauci is promoting the idea that we can have a vaccine ready for the world by the end of this year. It's out of the question.
The AstraZeneca COVID vaccine is being withdrawn worldwide after the pharmaceutical giant admitted it causes a rare and dangerous side effect.